Good morning. This is Dawn Monahan, and I'm going to voice and walk you through your lecture materials regarding self-care and safety for self in the workplace and in healthcare. First, PowerPoint can be found on Moodle under week 12, and the first PowerPoint will cover workplace safety and things that you need to know to keep yourself safe. So our objectives for this discussion would be to look at the different examples of things that can cause harm to a healthcare professional and review basic concepts of hazards, ergonomics, and OSHA. This is material from Chapter 3 in your Trees and Wilkins Davis textbook. And some of the things that you'll find in this chapter are listed here on this PowerPoint, pointing to things in the workplace that could cause us harm, such as electrical hazards, the risk of fire, musculoskeletal injuries, such as back injury, iatrogenic injury that can occur from things like needle sticks or instruments that we work with, radiation injury, exposure that would be covered, violence, and that would be not just, we've talked a little bit earlier in this course about incivility and lateral violence, nurse to nurse or healthcare professional to healthcare professional, but in a broader sense, the violence that we can sometimes be exposed to, such as violent patients that we care for or incidents that can happen in the healthcare setting. And then how do we prevent ourselves from getting hurt? And we'll cover that as well in this lecture. So certainly the number one way to prevent injury is to know the risks that you have given where you work, the line of work that you do, the type of unit that you are working on. There's lots in the literature that does describe that the highest rate of non-fatal occupational injuries does occur within the healthcare industry. This would cover illness as well, that we can sometimes be exposed to. So the first place we're going to start is talking about OSHA. You may have heard of OSHA before. This is the Occupational Safety and Health Administration. OSHA has federal laws that govern the way employers train and advise employees when there may be a possibility of harm or risk related to work. So it really was instituted and implemented to prevent employees. It expands well beyond healthcare. Anyone who works in really just about any area where you come in contact with machinery, equipment, supplies, or people, you would need to be aware of OSHA. So the big ones in healthcare that are unique to healthcare would be the bloodborne pathogen risks, things like HIV, Hep C, and Hep B, the hepatitis, which are transmitted through bodily fluids, in particular blood-borne fluids or blood-borne pathogens. So we implement standard or universal precautions always to prevent the transmission of those diseases. Other good examples would be, it's not every job that puts you within enough distance to have exposure to radioactive waves. So very specific training is provided for radiation exposure. And then also just the proper handling of equipment. A good example of that would be needles, handling needles or any sharps instruments that might come from the OR. So some other strategies that are used, you notice the biohazard label there. Whenever we're working with equipment that could possibly be tainted or contain harmful either substance or materials or equipment, it must be labeled with that very universal symbol that you see there on your PowerPoint. And those have to be properly disposed of, which means that the Healthcare Institute can't just take that and toss it in the trash. It has to be packaged differently, removed from the facility, and then processed differently as well. We always want to minimize any exposure, and we do that by using the proper use of personal protective equipment, are otherwise known as our PPEs. PPEs would be things like gloves, goggles, gowns, hair protection, masks, those things that are utilized to interrupt transmission. Universal precautions, you've heard me mention that already in this discussion. Those are the precautions that we apply to all patients, regardless of whether we know their healthcare status or not. Universal precautions is simply any time that we even anticipate the possibility of coming in contact with bloodborne or bodily fluids, we must don proper PPEs. So if I'm going to give an injection, if I'm going to draw blood, if I'm going to escort someone to the bathroom, then absolutely I must have gloves on. If I anticipate spray or splash, then I need to cover my clothing, obviously my mouth, my airway, and perhaps my eyes. The other type of precautions that exist are also transmission-based precautions, and those would be precautions that are unique to the transmission route that a disease or a pathogen may have, such as airborne, contact, or droplet, are the three more common transmission-based precautions. You'll learn about precautions and the specific types of precautions in your fundamentals course, but this is your introduction to the ways in which we protect ourselves, since we're talking about self-care this week. And those things are following these transmission-based precautions or universal precautions. Other things, the use of proper body mechanics to prevent injury to our backs in particular. We're at risk as nurses. So it's using large muscle groups. We're not bending at the waist. We're squatting to pick things up. We're not using our back. We let those large muscles support us, wide base or wide stance, we'll say, when we're moving patients. We're super attentive to using all the safety devices that are available, like sharps, and having the automatic covers or equipment that are provided to immediately cover up a used sharp needle. When it comes to radiation exposure, we pay close attention to time, distance, and shielding. And once we're within 6 feet of any radioactive device or unit, we have to don protective equipment to protect us from the radioactive waves. So usually it'll be an apron that we wear. We also need to wear a dosimeter. This is something that measures our time that we've been exposed to radiation. And never ever would a pregnant woman care for somebody who's receiving radiation or implanted or internal radiation. And then also other strategies that prevent or keep us well, and that is to be mindful that every hospital and unit has to carry or post an MSDS, which is a manufacturer safety data sheet that alerts us to any potential hazards from that particular fire safety. Another way to protect ourselves, this is something you probably want to sort of get to know and know forever. Anywhere you work, anytime you go to clinical, you will always be talking about how do we effectively evacuate and protect our clients in the event of fire. And we use the acronym RACE, R being rescue the patient. So if there's any patient in immediate harm, the first thing we do is we rescue them, even before we pull an alarm. Once everybody who is in immediate harm's way is rescued, we activate the alarm system, whether it be by a pull alarm or a phone call. We then contain shutting doors, using any kind of firewall that might be available to us, and we extinguish the fire. When we extinguish fires, we use the acronym PASS, and that is we have a fire extinguisher that we pull the pin, we aim at the base of the fire, we squeeze the handle, and we sweep in a sweeping motion as we use the fire extinguisher. We've already talked a little bit about ergonomics. The word ergonomics is how we use our body. And again, we're trying to prevent harm, in particular musculoskeletal disorders, back injuries, shoulder injuries, leg or knee or joint injuries. Again, nursing is considered a very high risk occupation when it comes to these types of injuries. One of the things about ergonomics that we hope all young nurses learn is to utilize equipment so that we don't have to always bend. So raising the bed when we're doing our bedside care, but of course we remember to put it back in low before we leave the patient alone, because that would be a risk to the patient. So protect ourselves, protect our patients, right? And then this is just a nice reminder that again, handling patients, moving patients, transferring patients has certainly taken its toll on our backs through the years, and it really is related oftentimes to mobility. We have wonderful equipment that is now available, like a Hoyer lift, but again, safe use of the Hoyer lift for both ourselves, the healthcare workers, and then also for our patient. And then just some further tips to prevent injury. If we are working in an office space, the proper way to sit, and you can see, like if you're sitting at the computer, you can see there in this little photo, the knee should be at a 90-degree angle. We should always have our lower lumbar back supported. We shouldn't be looking down at screens. We should be looking, I think it's a 10 to 15-degree angle down. If we're standing, we should always swap and elevate feet to take pressure off the back, and then you can see that lifting sequence that's offered there as well. Continuing on with self-care, safety for the nurse, workplace violence, it is a risk as a healthcare provider. We know that patients certainly are exacerbated by pain, by physical stress, physical pain, emotional stress, emotional pain. And there are times when patients can become unruly. So it is considered a hazard of our workplace. And you can see here by this slide that there's approximately 11,000 assaults that happen annually in the healthcare profession. And of those, or 11,000 assaults by people annually in the country. And these were 2010 statistics. And 19%, so 1 in 5, are happening in a healthcare setting. The highest rate is in mental health facilities. So there's different types of violence that are listed here. We've already talked earlier this semester about our horizontal violence or lateral violence, which is peer-to-peer. But then there's the patient-to-nurse violence, and it does happen where patients can become physically aggressive. Vertical violence can be organizational to the nurse, when a nurse feels as though the employer is causing and creating stress. And then there can be visitors who can come in and be a risk. There can be people who just come into the facility who pose a risk. Most of our hospitals, although we have locked doors in the middle overnight, you still have access at the emergency room door. We don't lock that door. And then are there nurse-to-patient violence? It's rare, but it does happen for sure. And this is just a nice list of some of the external violence risks. So those are the internal violence risks. Externally, we certainly can be at risk in the event of any acts of war, natural disasters, tornadoes, hurricanes. We stay. We don't go. Explosions, terrorist attacks, biochemical attacks. I mean, these are things that are difficult for us to sometimes process or think about, but certainly it's a risk to the profession. So who's at risk when it comes to violence? Believe it or not, male nurses tend to have a higher risk of having something perpetrated against them, and younger nurses would also fall into that. The emergency room I talked about, because there's really no locked door there. Geriatric units, simply because of confusion that can sometimes set in. It's a phenomena that is quite prevalent. We talked about mental health in a waiting room, because waiting is hard and it's a cycle. And also, we do find there's more violence in the large urban setting versus the rural setting. I'm going to sign off here and pick up with the